Hi, Guy. How are you? Where are you right now?
I'm in Israel, Shafi. How are you doing?
I'm good. I'm in Berkeley in my apartment. Uh, so let me just start the interview by telling the viewers that Guy was at Berkeley actually 2 weeks ago. He came for a visit as part of the Lattices program and applications to cryptography. And I guess what happened then?
There were increasingly dire warnings of different restrictions in Israel. So I think most of the Israelis at Simons at the time cut our trip short and came back to Israel to be in self-quarantine for 2 weeks. And I emerged from the self-quarantine to a more or less national shutdown. Not quite, but almost. And, you know, we're staying in place and trying to do our best to be good citizens and maybe do some research.
Yeah, and I guess soon after that was true about other countries, and almost all the foreign visitors left, and now we have the people who are domestic mostly and local, and they're all at home, so we've switched to a remote mode. But the reason that we're having this interview is because 2 days ago, I was looking at my WhatsApp account, and I've been getting a lot of messages, and pops up an announcement from the Marker newspaper. Talks about this novel application that the health service or one of the HMOs in Israel has launched to predict who would be hurt most by coronavirus if they became sick. And they say they're using novel techniques from AI to predict that. And that immediately rang a bell that this might have been related to some work of yours on something entirely different. So we're conducting this interview to kind of hope that you can explain to us what's the connection from the work that you've done on algorithmic fairness and this current news. So can you tell us something about algorithmic fairness? What is algorithmic fairness?
Algorithms and machine learning tools are having a larger and larger impact on our daily lives and on decisions being made about individuals. You know, everything from healthcare, which is relevant nowadays, to you know, the judicial system, loan, financial decisions. And you know, as computer scientists, we know that these decisions aren't necessarily fair. And we have a responsibility to really think about the ethics of these systems and of these technologies, and in particular, how they can affect different groups and disadvantaged groups is, you know, a particular focus of interest. So I would say the study of fairness isn't new. People across many, many fields have been thinking about fairness for millennia, but you know, computer science and its interaction with fairness is new. And we have a responsibility as computer scientists to think about these aspects of technologies that we're involved in. And hopefully, you know, as theoreticians and as computer scientists, we can also help mitigate or resolve some of these issues.
So when you say the word fair, it seems like a loaded word, and just probably means different things in different fields. And I understand that even in our own field, different technical definitions come up. It's actually a very interesting debate. What is the right definitions? Are definitions equivalent to each other? Are definitions even achievable? Is there some sort of a specific angle that your research on algorithmic fairness takes?
So I would say at a high level, you know, my background is as a cryptographer, and you know, what I like to do is, first of all, when we talk about fairness, and you're right that it could mean different things to different people, and the first thing we want to do is to think about the problem and, you know, rigorously mathematically define what it is that we mean by fairness in a particular setting or towards a particular goal. And what you're alluding to is that, unfortunately, you know, in fairness, things are, the problem is hard and things are complicated and they're very context dependent. Fairness can mean different things in different settings and to different people. So it ends up being quite a tricky arena to think about and to solve. And I think my focus and a lot of the theoretical community's focus is really on trying to sort of have a menagerie of definitions. Try to tackle different concerns that can come up, different issues, different settings, try to find some common themes. And so we can have a few different flavors of definitions of fairness, and we can study them And we can talk about, when are these definitions achievable? When are they in conflict with each other? What are the resources needed to achieve particular definitions of fairness? What are the trade-offs? Sort of try to build a better picture of the landscape.
So for example, maybe it would be helpful to ground it in a few examples for fairness, application domains. So I know that now that we're using algorithms supposedly to replace a lot of mechanisms for decisions that existed before in judicial, as you alluded to in risk scoring, right, for banks and school admissions, and even in medicine. Maybe there's one example that you think would be like the best to kind of explain what would be an unfair decision-making process and how could you make it better?
So maybe let's talk about fairness in the context of machine learning. And automated prediction, where usually the setting is that we have a data set of historical data, and we're trying to learn to predict future behavior. Maybe it's trying to predict who will recidivate if we let them out on bail. Maybe we're trying to predict who is likely to default on a loan. And maybe we're trying to predict who has the greatest odds of survival if we give them a certain medical treatment. And there are many, many issues in this setting. One serious issue, of course, is that the data you're learning from might have a lot of historical biases embedded in it. And due to these historical biases, what's going to happen is that the predictor you learn is going to be biased itself. So it's going at the very least probably to maintain whatever biases were in the data, and it might even amplify them.
I understand. So there's a specific work that you're involved in on multi-accuracy, I think the name is, multi-calibration, and I think it's a joint work with a few other people. And I was wondering if you want to say a word about this recent paper?
Yeah, so I said there are lots of concerns we might have when we're talking about discrimination. A different concern is, maybe the data aren't biased. It could still be the case that the machine learning itself, because it's trying to optimize for some global loss, might ignore some group. For example, they might ignore a minority. If the minority sort of looks different from the general population, the machine learning might optimize for accuracy on the general population and forget about the minority.
So when you say minority, I think that the thing that comes to mind is that there's some historical discrimination, or somebody has been aware of discrimination. I understand that one of the novelty of your work is that that's not necessarily the case. There might be groups that we haven't actually even identified in the past.
Right, so one of the big difficulties when we're trying to talk about underrepresented groups or groups that have faced historical discrimination is we are not always we don't always have an accurate picture of who the group are. Even if we're concerned with a large demographic group, it might be the discrimination doesn't show up in aggregate, but it really shows up clearly if you talk about a particular subpopulation within that group. And so often we just don't know, and that's a big difficulty faced by a lot of techniques that just try to look at things at sort of the aggregate level of a single group that we're concerned about. And in this work, we took a different path. And the idea is to try to automatically guarantee that whatever predictor we're learning, it passes certain sanity tests in terms of its accuracy on every group that we can efficiently identify from the data. In particular, this is a work dealing with multi-calibration or multi-accuracy, joint work with Ursula Herbert-Johnson, Michael Kim, and Omer Reingold, where the goal was to guarantee that at the very least, the predictor we have has an expectation when it's sort of predicting the expected risk of a particular group. It's the expected risk isn't wildly off. So we don't have groups where we see empirically in the data that the risk is say 0.5, but the predictor is saying that the risk is 0.9. Or we could require something even stronger, in particular require calibration. I don't want to get into what calibration is. But basically, for every group that we can efficiently identify, the members of that group that get, say, a prediction of 0.4 risk, 40% of them at the end of the day should be labeled 1, and 60% of them should be labeled 0, more or less.
So you mentioned that, you use the phrase for all subgroups that you can efficiently identify. So as an example, could you just try to check that all subgroups of size 100 are treated well, or the same as the general population in your, whatever your fairness measure exactly is?
So the problem is that, you know, in modern machine learning, when we're doing what's called agnostic learning nowadays, we usually have a predictor that's going to err. We're not going to have a perfect predictor. So any predictor we have is going to have some errors. And so, you know, requiring that the predictor is accurate on every group is impossible, because we can always, a posteriori, we can talk about the group of people on which the predictor erred.
Mm-hmm.
Okay, so we're not trying to guarantee, you know, we just can't have perfect predictors, and still we want to predict. So we can't try to look at all groups. And instead what we do is we take, I think, a very TCS, theoretical computer science, or complexity theoretic approach to it. And we talk about groups that can be identified from these particular data features using bounded computational resources. Okay, so maybe all of the groups that can be identified using polynomial size circuits, that would be great. Maybe all the groups that can be identified using a decision tree of a certain size, or a hyperplane. And now we're talking about a collection of groups that was defined a priori. And we want to satisfy some minimal sanity check for accuracy on all of them simultaneously. And I think, you know, and I think now thinking about it, you know, again, from a little bit of a theory perspective, the flavor of the guarantee is that no one can efficiently identify a group that is mistreated, where efficiently identify means from these particular features within a particular class within a particular computational class or a particular class of classifiers. And you know, mistreated can mean different things. In our work, we talk about mistreated, you know, with respect to accuracy. So we're requiring a certain minimal level of accuracy for all of the groups in terms of calibration, or in terms of the expectation being more or less where it should be. Excellent.
So I understand that even though I think that probably the first things that come to mind when somebody talks about fairness are things like recidivism or school admissions and so forth, one of the most interesting arenas is the medical arena, where you really do want to prescribe medicines that work for the entire population well, but often there are some cases where this is just not the case. You might need different treatment, different medicine, and so forth. And I understand that some of your work actually has turned to this direction. Is that correct? Can you tell us about it?
Yeah, so it's not a new problem in the medical arena. It's a problem they've been aware of for a long time, but they are dealing with risk prediction all the time. So, you know, they try to, for example, predict cardiovascular risk, the risk of having a serious cardiovascular event, or, you know, the risk of a certain individual developing a major osteoporotic fracture. That can be really a life-threatening event, usually for the more elderly. So, you know, medical professionals have, you know, since the middle of the 20th century or earlier, they are dealing with risk prediction for these things. And there are these old studies, these old risk predictors that are common in you know, cardiovascular medicine and in osteoporotic prediction, of how you actually, you know, identify a certain patient's risk. And then you intervene. For high-risk patients, you intervene either with drugs or behavioral changes. And these can be serious interventions. And one issue is that, you know, these predictors were developed on cohorts of patients that were not necessarily representative of the general population even at the time, and they're certainly not representative of the general population nowadays. Or, you know, maybe these were developed in the United States, but they're being used in Israel, which has quite a different population. And so it's a known problem that these predictors can be far less accurate on different demographic groups.
And specifically, I know that this is very data bound, right? The more data you have, the better predictions you can make. The more data you have even among those groups that you're trying to address, the better you can do. So I assume that the less data, the worse you're off. So in other words, what do you do in the case where you have a lot of data about the general population, but for some very easy to recognize subgroups, according to your definition, there's just not enough data? How do you, I guess that's the challenge, how do you address that?
That's a very good question, and it's far from a solved question. So it's a good question for us as theoreticians. to think about. Even when data are abundant, these kinds of issues can come up. We often optimize our machine learning procedures to output simple classifiers, because simple classifiers generalize well, but simple classifiers might ignore an important subpopulation. So it's a consideration. My experience in this particular arena came from a collaboration with the Clalit Research Institute in Israel, which is a healthcare provider that has over 1 million subscribers and has very detailed electronic records going back decades that they are trying to data mine for clinical insights. And they were very concerned about this issue with their cardiovascular risk prediction, say. And so we had a project applying these very theoretical techniques that were designed for fairness in order to guarantee calibration across a wide array of demographic and socioeconomic groups.
And I guess that probably brings us to the recent project that has something to do with the coronavirus. In fact, I remember that a day before you left Berkeley to go back to Israel, 2.5 weeks ago, 2 weeks ago, you got the call from Clalit that's asking you whether possibly you can use your fairness algorithm to help with the epidemic. So if you could tell us about that.
Sure. So, the healthcare providers in Israel are trying their very best to identify who are the people who are most at risk from complications should they be infected with a new coronavirus, with COVID-19. And the problem is that data is very, very limited and very hard, difficult.
On COVID-19.
On COVID-19, right? There, if we're talking 2 weeks ago, we're talking about dozens of patients in Israel.
What is it now?
And we don't. Now I think it's up to somewhere between 2,500 and 3,000.
Okay.
But still, even for those patients, we don't have complete data. So, we don't know, maybe they're at risk of complication, 7 days after they've been diagnosed or 2 weeks after they've been diagnosed. So we have very, very limited data. Still, they wanted to basically train quickly some sort of predictor, for example, so that the people who are most at risk would get a call from their doctor, giving them some guidelines on how what precautions they should take. So, even that level of intervention, let alone, the level of intervention you want when someone comes to the hospital, and, whether they should go and isolate at home or whether they need to stay at a hospital because they're at risk. Okay. So I want to.
And so where do you come in? Where does the fairness?
Okay, yeah. So before I say where fairness comes in and where this research comes in, I want to qualify everything I say by the fact that I am a theoretician. This is was a theoretical research project that is now having an impact on some clinical diagnostic tools. The translation from the theoretical research to what is actually being deployed in progress is far from being one-to-one. And I'm not at liberty to say everything that they're doing in practice. In fact, I don't know everything that they're doing in practice. So with those qualifiers in place, the idea that the researchers at Clalit, oh gosh, and I have to give a list of names earlier, but here I'll say the idea that my collaborators who I work most closely with at Clalit, doctors Noam, Barda, and Dagan, was that they would take their risk predictor for the flu, for which they have very, very detailed, fine-grained data going back decades, and they can predict pretty accurately who has most at risk for the flu. And that's kind of the virus that they know that is most closely related to COVID-19. So what they wanted to do was to start with that predictor from the flu and kind of tweak it, modify it towards predicting risk for COVID-19, for which we have very little data. And the only data they could come up with, the only data that they had at hands, were these aggregate statistics for various groups that were published in studies coming out of China. So their idea was to take their well-trained predictor for the flu and modify it using aggregate statistics that were published in studies coming out of China. Okay, so for example, they knew the aggregate risk levels for various age groups.
From China.
They had,
From China.
From China.
Yeah.
They had the various aggregate statistics for people with certain diseases, smokers. And now we want to take those and we want to take them together with our flu predictor to get something that's a better predictor for COVID-19. And I won't go into the details. I'll just say kind of what to me the high level similarity between these two settings is. In fairness, we're talking about having a predictor that is off for certain demographic groups that we're interested in protecting.
Mm-hmm.
And so the goal of our fairness definition is to come up with something that is at least in aggregate in terms of its expectation or its calibration accurate for all of these different groups.
Mm-hmm.
Okay, and similarly here, what they were wanting to do is to take a well-trained predictor that is off for these various populations who might be most at risk and to move it in an effective way to these different groups, to move it in an effective way to get good risk predictions or as good as they could with the data they had at hand for COVID-19.
So it's trying to wrap my head around it, and there's a whole bunch of issues that come up. So first of all, when you're talking about prediction, you were not predicting about who's going to get COVID-19, because I assumed that the data from China, perhaps I'm wrong, is not from random samples of the population, it's for people who already got the illness, right?
Right, so the goal is to predict who is most at risk of developing serious complications.
So I see. So so given that you
sort of conditioned on getting the disease, who is most at risk of getting complications?
Classified according to age, gender, previous illnesses, and so forth. Maybe smoking history and so forth.
So the people at Clalit Research in Israel have very, very fine-grained data with lots and lots of features that they can use. So they can use much more than simply your age and your gender.
Right.
For predicting the flu. What they don't have is labeled data for COVID-19 patients. And the goal is to take this fine-grained data for the flu together with coarse data about COVID-19 and sort of try to come up with our best effort predictor with the data we have in the moment. And of course, in a few weeks, in a few months, we're going to have, unfortunately, much more data for COVID-19 patients. And then we can take a different approach.
So it's fascinating from many perspectives, fascinating to me. First of all, the idea that something that really came up worrying about societal kind of aspects about fairness in, I think probably in the judicial system, in schools, in things that are sort of not related to life and death, at least it wasn't clear to begin with. Here we're talking about a very different scenario. Secondly, when you say the word fairness, what comes to mind is not, necessarily prediction of outcome or prediction of complication. So that's a beautiful transference of these notions, and very, what comes to mind again is the usual senses. They say unintended consequences, except in this arena of fairness and in general societal implications of AI or AI, people talk about unintended consequences of bad thing. So in other words, we invented technology and who knows what it's going to do to us. In this case, you invented this theoretical framework which had some applications already, but an unintended consequence is that it might say something about this epidemic or pandemic. I guess the one thing that comes to my mind, and that's sort of fantastic, especially as a theoretician where you have a notion, and if it's a robust notion or an interesting notion, it often finds applications in other settings. So even though it's fantastic, obviously we would prefer not to have this application, but it's very intriguing that it seems to be related. And the other thing that comes to mind is the speed, right? Because usually research, we have a notion, we discuss it, we prove things about it. It takes a while. Here you are supposed to kind of take it from one very theoretical setting to a very applied one in what, 2 weeks, 1 week? How quickly did this whole thing unravel?
Oh, well, I shouldn't say it was me because I was mostly in Berkeley and on a plane as this was happening. It was mostly researchers at Clalit together with graduate students, Daniel Greenfeld and Yona, and a researcher at the Technion, Uri Shalit. Yeah, things move, when there's a pressing need, things move at the speed of light. So I think on the one hand, as a theoretician, you have to be careful and you have to say, you don't want to overpromise. And, we can't invent an entire scientific theory of the field on the fly within days, when there's a pressing societal need. It takes time and it takes a big investment of basic research that I hope is going to be ongoing, and I hope is going to build a community doing these things in theory. And on the other hand, when you work on issues that are, where there's a pressing societal need, you can have an impact, and you can have sometimes an impact in unexpected places.
So right now, at this point, people from Clalit Medical Services, which is one of the HMOs of Israel, right, are getting announcements of whether they're in a high-risk group, depending on this application. Is that happening already?
Yeah, I think they sent out, it's on the scale of hundreds of thousands of people who are being getting various levels of notification.
And there's some sort of intervention that they are putting in place? Besides these announcements?
So what I know is mostly what I know from the article that you also read.
Is that right?
At the moment, yeah, in terms of what they're doing with it, how they're intervening clinically or thinking of intervening clinically, I don't know. At the moment, the main place where they want to intervene is in terms of actually getting a doctor to call the people who are most at risk and notifying them, kind of explaining that they're at risk and talking about what precautions they can take. And that can be quite valuable. I think in the future, I don't know if it's going to be this tool or a different tool that's trained using once more data is available, but this kind of prediction, I imagine, will also play a role in how sick people are treated. And actually that kind of brings me to a point that I think is really interesting and pressing, which is that we know that unfortunately with this pandemic, health systems can be strained to the point where there aren't enough resources to treat everyone and decisions have to be made. And we started worrying about fairness. Here we arrived at kind of a different application where fairness wasn't really a concern. We just wanted to do a particular kind of machine learning task with unusual data. But bringing it back to fairness, if we think about the decisions that are now going to be life or death about who gets treatment and who doesn't, being guided in some way by an algorithm, there are serious concerns about the algorithm and about the fairness of the decisions being made.
It's something that I was wondering about, that at the same time you are singling out these people and letting them know what measures to take. And this tool can also be misused. I mean, it's a question of definition whether it's a misuse. If at some point you have very, very scarce resources and you need to make decisions how to use them, I mean, that's an age-old problem, right? It's a very age-old philosophical, ethical question. How do you divvy up these resources? And it becomes even more so if you're going to use an algorithm to make those determinations. We're not talking anymore about getting a loan or not getting a loan, or getting accepted to Harvard or not, but we're talking about something much more important. But we're taking it to the direction that I don't think we should take it, because I doubt that is going to be the outcome. But it's something that I've seen again and again when we talk about fairness in theoretical computer science, and then we talk to lawyers or we talk to people from the social sciences. And here we are, we've invented this incredible tool, right? We've used mathematics, we've used data, we can do really good things. We can improve the systems. And at the same time, what they see is sort of what could happen if the tool got into the wrong hands or without thinking about it, and down the line, the horrible ramifications. And with this pandemic, everything gets sped up, right? The application seeing what can come out of it. We see it sort of in a, fast forward, but it doesn't have to get there.
I think the pandemic is showing us, in many ways, glimpses of the future and of the kind of life and death decisions that computer science systems will be involved in.
In a good way.
In a good way and in a concerning way. So, I mean, I think we have to hold both aspects of this. There's tremendous good that we can do, but there are also very serious concerns and perils that we have to think seriously about. And I think the promise of computer science, and especially theoretical computer science, is that we can really examine these kinds of concerns and trade-offs rigorously from a mathematical perspective. And sometimes, and I hope this is the case more often than not, we can say, you can have your cake and eat it too. We can design in other arenas, we can design protocols where we compute a joint function of our inputs, but nothing more is leaked about anyone's input. We can design differentially private algorithms that aggregate statistics without compromising anyone's individual privacy. And perhaps we can design automated decision-making tools that are mathematically and rigorously fair, whatever fair means in a particular context. So, maybe we can have our cake and eat it too. Maybe we can't. And as scientists, we can, that's also part of our job, to understand where the real trade-offs are, and those can inform how these tools are used.
Taking us back to the sort of lighter side, I must say that after hearing about this tool, and even after this interview, the respect that I have toward the kind of alerts that I get from my medical system have gone up tremendously. Usually I get these alerts, you should do this, that, and the other. I think they must be sending it to everyone. It's the most diluted version of advice that I could get. But what you are actually describing is something that might be quite different, at least in this case, where they've looked at my history. They've looked at the history of a lot of other patients. They've done sophisticated statistics. They have statistics from other countries. And they've singled out perhaps me or the group that's similar to me and gave me advice that I should be paying attention to. And which means that it seems that the team that you're working with is a very high quality team. And I wonder, who are they? Are they doctors? Are they computer scientists?
So this is the Clalit Research Institute, which is dedicated to gleaning clinical insights from their data using state-of-the-art machine learning techniques. And they're tremendously impressive. So what they've been able to do just in the span of a few weeks, and not only on this project, but on every project I've worked with them. They're doctors, data scientists, computer scientists, epidemiologists nowadays. The two people who I work most closely with, Drs. Noam, Barda and Dagan, are medical doctors who also have computer science degrees. And it's a very, very impressive organization. And the kinds of things I see them doing, I think are really a taste of the power of these computer science tools and what we can expect in the future.
I think that's tremendous. I'm so glad to see that the impact of work, in theory, in theoretical computer science, on algorithmic fairness, and your own work, making a difference. And I just wanted to mention, I guess, to our viewers that we've had a fairness cluster every summer in the last 2 summers where researchers came. Guy was there present, I think, both summers. And many other people came to Simons to sort of talk about different definitions, different algorithms, and have a workshop. And it's tremendous.
I hope we have more of these activities at Simons in the future. And I think to theoretical computer scientists or other scientists watching this, there are a lot of challenges in these fields and a lot of opportunity. So yeah, I hope if it sparked your interest, that's great.
Thank you, Guy. And thanks for staying up this late for the interview.
Sure. Thank you, Shafi, and stay healthy and safe, you and everyone watching.
You too.